sponsored by the Carpal Rx. If you're one of the tens of millions of people who suffer from hand pain, the chances are you have one of these three common conditions: carpal tunnel syndrome, wrist tendonitis, or repetitive strain injury. Any one of these three conditions can make your hand pain so severe that it makes doing your job or everyday tasks difficult or impossible. Like millions of people, you probably treat your pain with painkillers, but the majority of the painkillers people use are toxic or dangerous and result in over 16,000 deaths per year. Worst of all, if your hand pain is due to carpal tunnel syndrome, then you might even be considering surgery to treat your condition. But what most people don't realize is that most people who have surgery for carpal tunnel syndrome are dissatisfied with their results, whereas the majority of people who treat their carpal tunnel syndrome with non-surgical methods are quite satisfied with their results. These statistics are so important that the American Association of Orthopedic Surgeons and the National Institutes of Health recommend that patients try all non-surgical options before considering surgery. These options begin with the three basic steps everybody with hand pain should follow. They start with resting your hand, avoiding risky activities, and deep tissue massage. Rest means just that. It means not doing anything with your hands. Just as importantly, don't put a splint on your hand and then go back to the activities that cause your hand problem. And speaking of splinting, night splinting is one of the best things you can do to rest your hand. The next thing you should do is completely avoid the risky activities that probably caused your hand problems. Risky hand activities like working with a jackhammer or doing office work should be avoided completely, because if you don't, your hand will never get the chance to heal. Finally, get professional deep tissue massage of your wrist and forearm. But this isn't your everyday massage. It requires specific motions that, over time, will drain excess fluid and break up adhesions over the flexor tendons. This will reduce inflammation, thus reducing your hand pain and other symptoms. So as you see, you don't need dangerous drugs or surgery to treat your hand pain, even if it's carpal tunnel syndrome. Instead, professional deep tissue massage applied daily will be nearly 100% effective in alleviating your symptoms. However, applying it wrong or less frequently will not be effective. Remember, it must be done properly, daily, and for 2 to 4 weeks. To get this professional therapy for these conditions causing your hand pain, you don't have to visit a therapist every day. Instead, the Carpal Rx will give you the same therapy at home. If you have hand pain due to carpal tunnel syndrome, wrist tendonitis, or repetitive strain injury, then you owe it to yourself to try this remarkable product and take advantage of the 60-day free trial offer with every Carpal Rx. If the Carpal Rx doesn't relieve your symptoms, or if you just don't like it for any reason, return it for a full refund, including all of your shipping costs. The Carpal Rx was specifically designed to treat the wrist and forearm. It works just like a therapist's fingers, treating you for carpal tunnel syndrome, wrist tendonitis, or repetitive strain, except it treats you every day at a fraction of the cost of a therapist and in the comfort of your home. The Carpal Rx automatically produces the same motions that a therapist uses to relieve pain and other symptoms. And it's so simple to use. Just plug it in, slide it on, and strap it in. Then relax. The Carpal Rx will do the rest. The Carpal Rx always has a 60-day free trial, so if you're not completely satisfied with your results, return it for a 100% refund, including all your shipping costs. The Carpal Rx is guaranteed to permanently and easily get rid of carpal tunnel syndrome, as well as wrist tendonitis and repetitive strain injury. Visit the Carpal Rx at carpalrx.com.